Lymphedema is a terrible problem. Fortunately, a very small subset of patients who are treated for breast cancer develop lymphedema, but for those patients that do develop lymphedema, it is an awful, debilitating problem. If your lymphedema is so advanced that your tissue is hard and fibrotic, you are not a candidate for any microsurgery to improve the function of your lymphatic vessels. If your lymphedema is still early and soft, you may be a candidate for microsurgical techniques and solutions to help treat your lymphedema. The two basic types of physiologic or functional treatments for lymphedema involve a lymphovenous bypass, where we plug the lymphatic channels into veins. So in other words, we're bypassing the proximal lymphatics that are damaged by your breast cancer treatment and shunting that lymphatic fluid into the venous system. So that's called an LV bypass or a lymphovenous bypass. The other microsurgical technique used to treat lymphedema is a vascularized lymph node transfer. So this is a free flap or a transplant where we transplant lymph nodes as well as the artery and the vein that perfuses those lymph nodes. And the lymph nodes that are harvested are generally from the groin, in other words, the lower abdomen groin area, or sometimes from the neck area, and sometimes the omentum. So there's lots of different options to use as the donor site for the vascularized lymph nodes, and then we transplant them to the affected extremity. The most important part, or the most important thing to remember when doing a lymph node transfer, or a vascularized lymph node transfer, is to make sure that we're not going to cause lymphedema in another area. And that is why we specifically select lymph nodes and the blood vessels that feed those lymph nodes that can be sacrificed and moved without causing any problems in their absence. In other words, that area of the body doesn't need them. Without them, it's not going to develop lymphedema. So those are sort of the two basic microsurgical techniques to physiologically or functionally treat lymphedema: lymphovenous bypass and vascularized lymph node transfers. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.